What's good? It's your boy Jerome from JeromeWilderFitness.com. Now in this video, I'm going to tell you the 3 things that you can do to help lower high blood pressure. Alright, let's get into the video. Now, the first thing that you can do to lower blood pressure is increase your potassium. Alright, why? Now, a lot of people think when it comes to lowering blood pressure, lower your salt intake, don't consume foods with a lot of salt, stuff like that, but that's actually far from the truth because your body actually has what's called a sodium-potassium pump, and it is a very smart system. So when you lower your sodium intake without increasing your potassium, you just hold on to more of the sodium that you already have. All right, you don't lose any of it. So what we want to really zero in on is eating more potassium or intaking more potassium. That does not mean more bananas, all right? If you're someone trying to lose weight, someone that's insulin resistant, you don't want to increase bananas or things like Gatorade, Powerade, whatever. You don't want to have that type of, you don't want to get potassium from those things. What you want to focus on is green vegetables, the kales, the spinach, arugula, beet tops, broccoli, cauliflower, Brussels sprouts, all right? Things of that nature. You can also get an electrolyte powder, one specifically high in potassium. Like Vega electrolytes is really good. It's about 400 milligrams per scoop. And you should be zeroing in on getting about 4,700 milligrams. All right, so you don't want to think that because you're getting a little dinky 400 grams here, 200 grams here, that you're really doing anything, all right? You really want to get an abundance of potassium, all right? Second thing is lowering your cortisol levels, all right? Because when you're stressed, what happens is your body starts producing adrenaline, norepinephrine, all those things. It leads to your heart rate increasing, all right? Sweat glands start sweating, sweaty palms, sweaty back, things like that, and ultimately higher blood pressure. All right, so we want to lower the stress, whether it's psychological, physiological, we want to decrease it, all right? So first thing we want to do, obviously, is get out of the environment that's stressing you, right? If it's psychological, maybe you need new friends, maybe you need a new job, all right? Maybe you need a new country. Go move to Miami and live on the beach. Just kidding. But, you want to get out of the environment. So that's key. Then once you do that, now you can start taking things to build up your adrenals. So one would be B vitamins. You could get it in the form of nutritional yeast. You could get a B vitamin complex. Super amazing. All right. The second thing you can do to lower cortisol is adaptogenic herbs. So things like rhodiola, rhodiola ashwagandha is really good. Maca root, phenomenal. These are really going to help strengthen your adrenals, all right? You're gonna be more resistant or more resilient in the state of stress, all right? So those are great. The third thing is meditation, all right? Now for me, I use a biblical meditation app. It's called Abide. And the reason why this is so key is because usually it's not the situations around us that make us stress. It's how we think about those situations. So if we can take our thoughts captive, replace the negative thoughts and put in positive ones, now we can start creating a more balanced, a more calm inner disposition, and we can solve whatever issue comes at us. Because it's never if the next issue comes, it's always when, right? So we want to be inwardly prepared, all right? Don't be caught off guard when a trial comes at you, all right? Because, that's how you get caught into, falling into quicksand, depression, anxiety, drug addiction. Like you just fall into this state of self-soothing and you're no longer in a state of self-care. But that's for another video, but we don't want to get into that place, all right? So those are some things, meditation. Adaptogenic herbs and B vitamins for lowering the cortisol. The third thing is losing weight, all right? Now, insulin resistance is actually a causative factor to high blood pressure, all right? And most people that struggle with their weight issues, they have insulin resistance. So we want to start losing weight, all right? The key, this is what I teach my clients, is following a lower carbohydrate diet, and intermittent fasting. All right, that's going to lower your insulin levels, allow your body to tap into your fat storage, and will assist in lowering blood pressure. Now, keep in mind, when you follow a lower carbohydrate diet, when you start intermittent fasting, what's actually going to happen initially is your body's going to dump out a lot of water. That's why a lot of people, when they start a diet like this, they're like, oh my gosh, I'm losing so much weight. I'm so happy, right? Like, it's a miracle. But then generally it starts slowing down, and then you got two people in the world. You got the people that are like, oh my gosh, it's not working anymore, I'm going back to my old ways. But then you got the people that understand that it was water weight that they got rid of, and they, you know, continue going at a moderate 1 to 2 pounds per week weight loss rate. All right. Now, with that being said, we want to make sure we're replacing all of the minerals that are getting flushed out, all right, especially the potassium, because when you flush out all of that sodium, it causes a lot of issues in your body. So we want to replace all of that with high potassium. So like I was mentioning here, the kales, the spinach, the arugula, the broccoli, all the green leafies, all right, and all the cruciferous are really good, and adding an electrolyte supplement. So you could say 1 and 3, you know, so to speak, they go hand in hand. All right, so these are things that are going to really help you lower your high blood pressure, and a lot of other issues as well. All right, because generally high blood pressure is a sign of a lot of different symptoms. So, you know, don't take this lightly. Take this seriously, guys, because there's a lot of negative consequences that you can experience by not taking this seriously. All right, sudden death is one. You could get a heart attack at any time when your blood pressure is high. You could get a stroke. All right, yes, a lot of people survive strokes, but then some people get paralyzed from strokes. Some people get blindness. Some people get blurry vision. Like, there's so many things that you can experience that are not good if you don't take care of this blood pressure issue. So if you know anyone, or if you yourself is dealing with this, make sure to take this into consideration. Share it with somebody that you know if you feel like they could benefit from this, all right? Now, if you like this video, please drop a like, leave a comment below, and subscribe so we can spread the message of good health and fitness, all right? Peace.